Hey guys, me, it's Dr. M. I want to show you something on this slide about acne that you may not be thinking about. Look at this tongue right here. See how it's white and it's coated? That could be a condition what's called Candidiasis albicans, or basically yeast overgrowth. So if a patient has acne and they're taking just topical types of stuff going on and they're not, addressing yeast, fungi, or bacteria, then they're not going to get the skin results that they're actually looking for, because that's too much yeast overgrowth, overgrowth. So in this particular case, that patient obviously would want to not have, for their diet, have too much sugar into their diet. And if they've been taking antibiotics, they definitely would want to start taking some type of probiotic. The other thing when you're looking at that white coated tongue, what you want to be thinking about also is that, if you have a history of taking asthma or, Ventolin or breathing issues, you immediately want to go ahead and brush your teeth right after you take that inhaler, because those steroids will actually lower your immune system, and they can also produce more issues with yeast and so forth. And so cut out your diet, get out the sugar out of your diet as much as you can, use stevia instead, and definitely try to avoid breads, pastas, and all that other stuff as much as possible, so that anything that turns into sugar in your body, it'll feed that yeast. And if you've been on antibiotics, then obviously, you want to definitely make sure that you take a good healthy probiotic as well too. Okay, so that's one of the first patterns. You don't want to just look at acne, skin issues, or unhealthy skin problems just alone from topical types of stuff, because there's some dangers associated with those type of medications as well. And as a disclaimer, guys, I want to let you know, listen, I'm a holistic physician. I want to make sure that I'm not your doctor, so I can't give you any medical advice or tell you what you should or shouldn't be doing. I'm telling you personally what I would be doing, or for my family, but I'm not your doctor, so I can't tell you exactly what to do, but I'm giving you certain ideas that you should be thinking about if you are having issues with acne. Okay. The other thing I want to have you take a look at this one. Look at this pattern. This is a forehead acne picture, responds well to digestive treatments, excuse me. So basically, when you see acne on the forehead, again, that's going to respond typically very well to issues with digestion. And so again, a big culprit that you want to really try to avoid out of your diet when you're looking at that, you'd want to, number one, you want to get rid of the sugar like we said before. The other thing that you'd want to do is you'd want to make sure you get rid of the dairy types of products. So dairy is going to be not going to be good for skin issues. And the third thing that you want to do is you want to make sure that you're getting a lot of good healthy fat that the Creator made. Not man-made fat, but good healthy good fat. And so if you're doing that, that's going to help your skin condition. In addition, you want to be drinking lots and lots of water. And then you're also going to want to make sure that you get enough good healthy green vegetables, a lot of fiber in your diet, because that will also help your skin look vibrant and healthy. And so those mixers, juice mixers, meaning like Vitamix and so forth, those blender types, and making that, you'll notice that your skin, if you put the right ingredients into your smoothie, boy, will your skin look young and vibrant and healthy. Look, I'm 49 years old, guys, and I'm just telling you some things that I've seen over the years work amazingly for my patients as well as for myself. So at 49 years old, I don't feel like I look 49 years old. My skin's vibrant, very elastic, very healthy, very shiny. And so I'm just giving you some great tips that have worked well for watching patients over the last 20 years, and even in my practice, as well as myself and my family. Okay. Next thing, what I want you to take a look at, why don't you take a look at this one? This is another pattern what we also see. Acne in the eyebrows or between the eyes. Now that could be what you're seeing is acne in through the eyebrows, or you could have actually acne right in through that middle part of the eye. Okay, what that could be is a pattern where people have issues with their liver. And so what happens at liver is it's a great detoxifier. It gets rid of a lot of toxins out of your body. But if that liver gets congested, if those chemicals start getting all clogged up like a sponge with, that's porous, and now it's got toxins inside there, liver congestion starts occurring. And so one of the patterns that we see is that we start seeing acne along these areas, the eyebrows and the middle parts of the eye. Okay, so that could be an indication that it could possibly be a liver type of problem. Okay, so now how can you get toxicity? You know, well, if you're having drugs or having taken medication, that could obviously lead to toxicity. Even if you're taking a lot of supplements, that can lead to toxicity, especially if they're not good quality supplements. And I've seen a lot of supplements over the years. I've tried a lot of different things. In fact, even like when you look at capsules in a supplement, did you know that you could take a good healthy supplement, like a fish oil, for example, and the capsule itself is made with glue fillers, and so you're getting something healthy on the inside, but on the outside, not too good. And so we want to make sure that you're getting good, healthy nutrition and not toxicity in your body. Then you could be drinking good, healthy water. You're thinking you're drinking good, healthy water, but you're putting your water in plastics, and it's leaching chemicals, so you could be getting toxicity. Then we're eating processed foods and box stuff. We can be getting toxicity. Then we're putting, deodorant on with aluminum. We could be getting toxicity. Then in addition, we're washing our dishes, and we're noticing that when we wash it and put it in the dishwasher, you open it up and that vapor comes out of there for the dishwasher. That could be all toxicity, guys. You get in a new car and you smell that new car smell. Guess what? Those are fumes. That's toxic. Then you could literally be perfect, right? And bottom line is that somebody out in the fields, a couple blocks or miles away from you in the corn or whatever, spraying chemicals over there. The wind comes and bam, the wind takes those chemicals and you're breathing it. So what I'm trying to tell you is it's hard. It's really hard to avoid toxicity. I mean, we're all going to have some form of it. And so, some of those signs with the liver, what you're seeing is that definitely can be an issue with acne. So you'd want to address some detox with the liver. Okay, now I'll show you another pattern that can occur, what I've seen with acne as well too, and it's really pretty amazing what other things we're seeing. Acne on the cheeks. Now that could mean you're having issues with your lungs, or having food allergies, or just regular allergies, and or food sensitivities. Now let me explain that a little bit further to you. Okay, listen. You could have allergies from something that you're putting on your skin, bathing and so forth. It could be from the detergents when you're washing, touches your skin, you put your clothes on, it rubs against your face. That could be an issue. It could be your pillow. People that have allergies and sensitivity to environmental stuff, they're sleeping on pillows with feathers. All these things can affect your immune system. Okay, the other thing is that you could have, an immediate emergency allergy with the foods that you're eating. Like God forbid, like, you're eating peanut butter and you have a reaction real quick. That's dangerous, right? That's what's called an IgE response, where a lot of people they don't even recognize it and they don't equate that to their skin. They have what's called, not an allergy, they actually have what's called a food sensitivity. And there is a difference between an allergy and a sensitivity. A food sensitivity, you could eat something, feel completely fine that day, and 2 or 3 days later have headaches, break out, and you don't realize that the food that you're eating could be a food sensitivity. And in functional medicine, one of the things I do, when we do the blood work, you go to a functional medicine doctor, they're looking for not just IgE, which is an allergy, they're actually looking for what's called IgM. They're looking for delayed responses in your blood that could indicate from that food sensitivity test that you should not be eating that because you're having a reaction, a delayed reaction a little bit later. So patterns on your cheeks of acne or breakouts not looking the way it should look could be an indication that you're having allergies, food allergies, or actually having food sensitivities, eating something that you should not be eating. Okay, so let me show another great pattern. I know it's very powerful, packed information I'm actually showing you, but man, it's some good stuff here. Then we got it right here. We got some acne on your nose. Now, what does that mean, acne on your nose? Well, that could be an indication that you are having heart issues. So sometimes we see people suffering with blood pressure problems display this pattern. And so how do you get rid of that? Well, one of the things you could do is you want to get rid of, especially with heart and blood vessel type of stuff, you want to use and get rid of that is the inflammation. That's huge. You want to get rid of the inflammation. So one of the things you could do, you could try fish oils, and it all depends. Again, you want to have a clean product of fish oils. If you ever want, some stuff that I recommend, then you can always obviously look me up, therealdoctor.com. Again, that's therealdoctor.com, and I could give you some suggestions or make a comment on here, and I'll give you some suggestions as well too. Coenzyme Q10 is another good one for your heart, and turmeric. I especially like Apex. I think they make a great product called it's called Tumero. It's an excellent product. And then also another thing is you want to do is you want to get rid of the sugar, and all that helps with the inflammation in your body. And so, bottom line is if you're having heart, blood vessel issues, these are some suggestions that I've seen work very well for my patients over the years. Number one, you want to control the inflammation. And so just simply put, controlling the inflammation, one of the things you could easily do, right? Get rid of the sugar, because sugar definitely causes inflammation inside your body. Other thing is something suggestive is that I would suggest if you like meats, you like a lot of meat types of products, if you can afford it, obviously buy as much as you can, organic as possible. It does make a difference. One of the things that we found out and through the studies is that when people buy animal foods that are not organic and made with chemicals and hormones and other kind of chemicals, their fatty acid ratios of omega-3, omega-6 is way off the chart. And we see that in problems with autistic kids, people with depression, probably people with health problems and pain. They're getting omega-3, omega-6, but their ratios are way off. And depending on the research that you read, some research says it should be a 4-to-1, other research says a 1-to-1. But bottom line is it should be lower, more ratios are evenly where we're finding out. And when people that are having the store-bought meats made with chemicals and hormones, these same meats, they end up being like a 20-to-1 ratio. So those ratios can cause inflammation inside the body. So we'd like to have, is as much natural as possible and foods that the creator made. If man made it, the war's on. Your skin's not gonna look good. But if you're eating food that's gonna be that the creator made, and you're eating your food and you're chewing your food at least 25 times per bite. What, 25 times? 25 times, so that way your digestive tract doesn't have to work as hard to break down that food, and then you can excrete the toxins that you don't need, and then your body can use what it needs into the cells and the nutrients and give you nutrition and good health. Your skin's going to look a lot better. Okay, so you want to get rid of the inflammation, get rid of the sugar, fish oils, the right types, coenzyme Q10, turmeric, Tumero, all of those things will be a really good thing for you to be eating. Okay, and that'll help your skin quite a bit. Okay, a couple other things I want to point out to you. All right, let me get through that with you. So what about if you get acne into the jawline and chin? That's the most common, and that's typically hormonal issues. And chin now sometimes can be digestive, but jawline and chin, most common hormonal issues. Really important, guys, listen, is that, I wish out there I could tell you that we had the Holy Grail, and this is the answer for you, and this, because it worked great for this person, it's going to work great for you. It's not going to happen. Everybody's a little bit different. Treatments are different, and it's up to the doctor to be very, a problem solver to figure out what's going on specifically for you, and sometimes we have to solve problems to figure out how to get the best outcome for you. There is no Holy Grail. I'm giving you patterns and suggestions, but there is a thought process in it. And this most of the time, these jawline types of stuff are going to be hormonal type of issues. Here's the other confusing part. When you go to your doctor, they'll look at your hormones and then say, you're fine, so don't worry about that. Well, that's true that you might be normal for your hormones overall, but it's a lot more complicated than that. In functional medicine, we don't look to just your normal. We look for timing. We look for patterns beyond just the global number. Okay, so a person, for example, could be suffering with acne, and they're breaking out worse than other times, and it's because they're getting a spike in their estrogen and then a crash in their estrogen, for example. Okay, or progesterone, or estradiol, doesn't matter, testosterone. What happens is that spike maybe should have occurred at a different day so that there wasn't as a crash as much. And so there are tests that a functional medicine doctor can do that are basically not one test one day, but 30 days. And that 30-day test tells you where that person's hormones should have been at to be balanced as much as possible. Even though the other ones were in their normal range, now we're optimizing that. And by optimizing that, a lot of times you can clear up that acne that goes onto the face, makes your skin look nice and shiny, healthy, you look beautiful. And so that's one of the things that, that are other options out there rather than just slapping on some topical type of stuff, okay? There's always more causes. These are just symptoms of something else going on inside the body. And so just keep that in mind. There are many different causes that people have of why they get acne, and I'm showing you some patterns out here today. Another thing, a pattern we're going to see is outer part of the eyes. We want to think kidney. Outer part of the eyes, we want to think kidney. So with kidney, what are we looking at? We're looking at dehydration, and we could also be looking at the adrenal glands. Hey, you know what? Sometimes when people are having acne around the outer part of those eyes, they could be doing something as simple as not drinking enough water. Or they could be doing something as simple enough that they're not retaining the water that they should be drinking. And so, they need to put like a fizz or electrolytes into it, not with sugar in it, but with just pure electrolytes or minerals. So they get better absorption into their cells, and so their cells are actually doing something with that water they're actually drinking. The other thing is that if it's outer part of the eyes, acne, that can also be an issue of their adrenal glands. These are little walnut-sized glands that sit on top of your kidneys, and those affect your cortisol level. And so if you're under stress, on a daily basis, or, you got a test coming up, or work, or school, or money, whatever it is, relationships, that stress could affect your adrenal glands, and that affects the cortisol level. And that, man, when that starts getting affected, I got to tell you, that can affect a cascade of events that occur in different parts of other parts of your body that will affect the hormones in other parts of your body. And so that can lead to inflammation, it can lead to hormone imbalance, that can lead to what's called catabolic physiology, and little by little the body starts breaking down, lead to toxicity, and then we have acne not just here, we get acne here, we get acne here, we get acne here, in different parts, and nothing makes sense. And so we're always trying to look to see what's the underlying cause. But if it's just in those areas, guys, think kidney and think adrenal glands, and then we figure out a way to try to solve that kidney and adrenal glands. And there are a lot of great natural things you can do for the kidney, detoxification, and then obviously drinking lots and lots of water, and then addressing those stress issues will help with your acne as well too. Okay, I want to show you another real good pattern that you may actually see. So I've kind of addressed everything for you. So number one, I talked about the acne on the tongue, right? We talked about that is could be an issue with digestion where you have way too much sugar, yeast, bacteria overgrowth, so you want to get rid of that. Get rid of the dairy. You want to get rid of, have good healthy fats and a lot of fiber, green leafy vegetables, drink lots and lots of water. If you've been on antibiotics, obviously take a good healthy probiotic, at least 20 billion I would recommend, live as much as possible. And then you want to also make sure that you don't, that you're, if you're putting an inhaler in, that you're brushing your teeth and brushing your tongue, so you're not creating thrush issues in your mouth that can go into your digestive tract really easy. Then if you're getting acne on your forehead, that could be a digestive issue, so you want to address those digestive types of issues and eat food that the Creator made and not what man made, and clean as possible. If you do that, your skin is going to feel a lot better. And guys, I've even had patients, no joke, that have had shingles where they were breaking out in vesicles on their skin. Their skin looked horrible. They were in a lot of pain, and the doctors wanted to give them steroids and all this other stuff, and basically put them on a green healthy juice fast for 3 days. And within 3 days, those scabbed up, and they're literally gone in about 4 or 5 days. But they scabbed up on the 3rd day, and it was just from their diet. Okay, so don't take the diet very lightly, because it can make a tremendous difference on what you're eating. And obviously, you probably innately already know that, because when you eat right and you not only feel better, you exercise more, you move more, and your skin, it glows. Okay, our acne we talked about the acne on the eyebrows and in the middle. That could be an indication of liver and toxicity issues. So you want to address, the toxic issues, whether it's alcohol, whether it's drugs, whether it's the foods that you're eating that's chemicals sprayed and poisonous. You want to get rid of those toxicity as much as possible. And then we talked about acne on the cheeks. Could be allergies. It could be food allergies. It could be also food sensitivities, right? It could also be that as well too. So you want to address that as well. And then we talked about, acne on your nose could be an issue with your heart or blood vessels, and some of the great things you could do with that, with the turmeric, get rid of the inflammation without the sugar, eat God healthy foods and a lot of water, and decrease your stress. See a pattern here, guys? All about healthy living, right? Now then we talk about acne on the jawline. What is that? It's the most common. Could be hormonal issues, and there are natural tests that you can do to help with that as well. And it can obviously in the chin, it can also be digestive as well too. And then we talked about the outer part of the eyes. That could obviously be kidneys and dehydration and the adrenal glands and stress. So guys, I just gave you a lot of information pretty quick. I'm trying to educate you, because the more educated you are, then there are some things that that you could do, or you could help others. Just try to get yourself better, rather than just seeing a doctor right away. Trying to do some healthy things for yourself, but that doesn't replace going to see a doctor, because I can't tell you what to do. Remember, I said that I can't tell you what to do, but what I would recommend for you all to do is do something healthy today. And if you found this information helpful, guys, I'm newer on YouTube. I'm learning what I'm doing. I'm going as I'm learning. And so, guys, I would appreciate if you could like it and share it, subscribe, do whatever you got to do. I don't know where those buttons are, but bottom line, I could definitely use the help. If you guys like what I'm doing, I'm going to put it out there, and I'll continue to make great videos and great information that will help you, but give me a little bit of help as well too, okay? All right, guys, you've been listening to Dr. M. Take care. God bless, and have a great, wonderful day.